Imagine a country where childhood vaccination is entirely voluntary, where the state doesn't mandate but meticulously invites, where the schedule is lean, missing vaccines common in other nations, and where data from over 1 million children provides some of the world's most powerful answers on vaccine safety. This isn't a thought experiment. This is Denmark. In 2025, its program stands as a fascinating, data-rich counterpoint to the polarized vaccine debates everywhere else. Is it a model of restraint or a gamble with public health? Welcome back to Health Inside Anatomy and Science. I'm Dr. Your Name, or channel host name, and today we're conducting a forensic analysis of the Danish childhood vaccination model. We'll decode its unique choices, examine the staggering 1 million child study that just reshaped the safety debate, and ask the critical question for a global audience. What can the world learn from a system built on trust, data, and voluntary participation? The Danish philosophy, selective protection, and the herd immunity calculation. The Danish schedule is a masterclass in targeted epidemiology. Unlike the US CDC schedule, which recommends vaccines against 14 to 16 diseases by age 18, Denmark's program covers 10. The omissions are strategic and debated. No routine chickenpox vaccine, varicella. Denmark used chickenpox as a generally mild childhood disease. Their calculus weighs the benefit of individual protection against the risk of shingles later in life, in the goal of maintaining natural immunity cycles within the population. The US, by contrast, has seen a dramatic drop in hospitalizations and deaths since implementing its routine varicella program. No routine rotavirus vaccine. This is perhaps the most controversial exclusion. Rotavirus is a leading global cause of severe dehydrating diarrhea in infants. Denmark relies on robust hygiene and healthcare access to manage cases, while other countries prevent them outright. No routine hepatitis B for infants. With low prevalence, Denmark vaccinates only high-risk infants, betting on its epidemiology rather than universal coverage. This selective approach is underpinned by one of the world's most powerful tools, the Danish civil registration system and linked health registries. Every citizen has a unique ID, allowing researchers to track health outcomes across a lifetime with unparalleled accuracy. This system is what made the landmark 2025 safety study possible. The 2025 landmark study, 1 million children and the no-link verdict. In 2025, Danish researchers published a monumental study in a top-tier journal like the New England Journal of Medicine, or JAMA. It followed over 1 million children born in Denmark over more than a decade, comparing incredibly detailed health outcomes between vaccinated and unvaccinated cohorts. The findings were unequivocal. The study found no causal link between the vaccines in the childhood program and autism spectrum disorders, ASD, asthma, leukemia, type 1 diabetes, or other major neurodevelopmental or immune conditions. But this study did more than just say no. It demonstrated why the previous smaller studies that fueled fears were flawed. It accounted for the healthy vaccinee bias, the fact that children who are already sickly might delay or miss vaccinations, making the unvaccinated group appear less healthy to begin with. By using the entire population registry, this bias was eliminated. This isn't just another safety study, it's arguably the most methodologically robust one ever conducted on this scale. The engine of trust. How does Denmark make voluntary work? A voluntary system only functions with high uptake. Denmark's childhood vaccination coverage consistently exceeds 90%. How? The gatekeeper, the general practitioner, GP. In Denmark, your family doctor is your primary health navigator. They administer vaccines, building a relationship of trust over years. This personal, consistent medical advice is far more powerful than a clinic visit with a stranger. The digital backbone, the Danish vaccination register. This isn't a passive record, it's an active engagement engine. It sends personalized digital invitations and reminders directly to parents. It automates follow-up, removing the cognitive burden of tracking a complex schedule. Societal trust and low disinformation penetration. High trust in public institutions and healthcare authorities creates a societal norm where vaccination is the default, responsible choice. While vaccine hesitancy exists, it operates against a strong, data-backed consensus. This model presents a stark contrast to systems where access is fragmented, trust in institutions is lower, and misinformation spreads virally online. Denmark invests in infrastructure and trust to make the easy choice the healthy choice. The omissions analyzed, a risk-benefit breakdown. Let's apply our anatomical lens to Denmark's choices. Is their model prudent or risky? The rotavirus gamble. Rotavirus is brutally efficient. It causes severe dehydration through a specific attack on the villi of the small intestine, crippling water absorption. While Danish hygiene is excellent, the virus is notoriously contagious. The decision avoids vaccine cost and any minuscule risk, but accepts a calculable number of hospitalizations each year. The chickenpox strategy. The varicella zoster virus has a sinister double life, acute chickenpox and later shingles. The US vaccine program has reduced chickenpox cases by over 90%. Denmark's approach avoids shifting the epidemiology of shingles in adults, but accepts the complications of natural infection, including rare but serious encephalitis and bacterial superinfections. The HPV paradigm shift. Here, Denmark is a leader. By vaccinating both boys and girls at age 12, they aim for direct and herd immunity against cancer-causing strains, targeting the virus before sexual debut. This is a clear, proactive investment in long-term cancer prevention. The global takeaway. Can this model be exported? The Danish model offers critical lessons, but it is not a one-size-fits-all solution. Lesson 1. Data transparency is the ultimate antidote to fear. The 2025 study shows that investing in world-class, transparent safety surveillance builds irreplaceable public confidence. Lesson 2. System design matters. Integrating reminders into a trusted digital health infrastructure significantly improves compliance. Lesson 3. Context is everything. Denmark's homogeneous population, high trust, and strong primary care system are prerequisites. A nation with lower trust or fractured healthcare could not simply adopt a voluntary model and expect similar results. The core takeaway is this. Denmark's success isn't just about the vaccines they give, it's about the robust, data-driven, and trust-based ecosystem they've built around them. The Danish childhood vaccination program is a living laboratory. It demonstrates that high uptake can be achieved without mandates through a foundation of trust, seamless access, and unwavering commitment to data. Their 2025 mega-study may be the final word in a decades-long safety debate. For the rest of the world, the question isn't whether to copy their schedule, but whether to invest in the kind of transparent, trustworthy health systems that make such a schedule possible. If this global deep dive into a different approach to vaccination changed your perspective, give this video a thumbs up. It tells YouTube this is the kind of nuanced international science we need. Share it with anyone interested in public health, data, or smart policy. Subscribe to Health Inside Anatomy and Science. We analyze the world's health systems to find the universal principles of wellness. Stay curious, stay critical, and stay protected.